This is a competency using a J0 dynamometer testing for consistency of effort by Yemisi Adewale and Oriana Barthemus. The relevance of consistency of effort to occupational therapy is due to the effect that decreased grip strength and inconsistent application of force can have on functional activities. Being able to measure patients' individual ability to produce maximum effort by a consistent basis can be applied to treatment at intervention planning related to strength, stamina, and fine motor activities. We're going to cover the parts of a dynamometer, changing the handle, patient positioning, safety precautions and contraindications, the procedure, and graphing the data and data analysis. The parts of the dynamometer are consistent of the gauge, which is what is seen in front of you. On the inside, you have the kilograms, and on the outside is pounds. The little red needle is the peak hold needle, and that is what will stay in place. This is also what the therapist reads in order to get their results. The following pieces also include a handle, the handle positions, which are the notches on the top, a guide, a post, and a handle clip located at the posterior arm of the dynamometer. Changing the handle. In order to change the handle, the therapist must first locate the handle clip and undo it. Then slide the handle out from the superior post and replace it back in to the handle positioning notch desired. Then slide the posterior side of the handle back over the posterior post and secure the handle clip. Patient positioning. The patient should have their feet flat on the floor, sitting upright, their back against their chair. Their arms should be bent at 90 degrees at the elbow, and the wrist should have no more than 30 degrees of extension. Before doing a consistency of effort, the therapist should first complete a hand screen to make sure that the patient has the functional mobility and abilities to complete the assessment. Safety precautions and contraindications include that this test should not be performed unless the therapist has received an approval from the referred physician that allows the patient to participate in resistive exercises or strengthening. If the patient has had tendon repair, transfer, or laceration less than 12 weeks prior, if there's excessive pain in the hands, there's flare-ups, tissue damage, edema, sensory loss, or other traumatic injuries to the hand. The procedure. When it's time, the patient will be instructed to hold the dynamometer in the testing arm. They will be told to squeeze as hard as they can until the therapist tells them to stop. When they stop, the peak hold needle will be at the highest point, and the therapist will write down that number. And you will do it for each handle, so you should have 5 numbers at the end of your testing. Graphing the data and data analysis. You should have each of your handle numbers and your pounds or kilograms scores recorded. And then after all of the data has been recorded, you should make a graph where you have the handle position on the x-axis and your pounds or kilograms on the y-axis. Then plot each point on the graph and connect them with a line. After connected, if the patient is displaying a consistency of effort, there will be a bell-shaped curve in the graph. If there is not a bell-shaped curve, then the patient they do not display a consistency of effort. Thank you for watching.